Hello guys, welcome to my YouTube channel Legend of Pharmacy. Yes, today in this video, let's discuss about the tranexamic acid. A review of this tranexamic acid, that is a Trenexa 500. See, one of the very important tablet. Okay, and especially this video is for those who are suffering from excessive bleeding. Hmm. Let's start with the composition. See, this tranexide contains the tranexamic acid, either the tranexamic acid in 250 mg or 500 mg or 650 mg. This is the actual composition, either it contains the 250, 500 or 650. Then uses of this tranexamic acid, basically tranexamic acid, it is the anti-fibrinolytic agent. Means what these will do means these will stop the bleeding, any bleed in any age. If there is a successive bleed or bleeding for the prolonged time, to stop the bleeding, we are giving this tranexamic acid. It is the basic use here. Then it, especially this drug is proven in menstrual bleeding. Okay, there is a heavy bleeding in a woman during their menstrual cycle, so to prevent that menstrual bleeding, it is highly recommended by the doctors, highly recommended. And also different types of the bleeding disorders like bleeding from the nose, bleeding from the anal and gastrointestinal tract bleeding. Okay, there also we are giving this one, that is a tranexamic acid. And it is also used in the melasma also. It is considered, we can use that in melasma. See, this one is the menstrual bleeding. This is a normal type of the menstrual bleeding. Okay, means it's light bleed, it's a normal. But here see, you are observing it is a very heavy bleeding. In this, we are especially the doctors will prescribe this one tranexamic acid. The dose we will discuss the later. And also in the melasma, see here, we will observe the hyperpigmentation on the skin, that is known as the melasma. To treat the melasma, we are giving this tranexamic acid. Complications, it is not recommended in stroke and not in premenstrual cycle. Means premenstrual cycle you cannot give. Okay, after bleeding occurs, okay, in that time only you can give this tranexamic acid. You can't give in the premenstrual cycle. Okay, before bleeding or before menstrual cycle you cannot give this. Then in pregnancy it is recommend, means it's not recommended in pregnancy, but doctor, if doctor wants, means he can prescribe in emergency. Then breastfeeding also, it can pass through the milk, okay, and it leads, means it's get sucked by the baby. Then low dose in liver kidney disease patients. Side effects include here some of the nausea, vomiting, diarrhea, weakness, muscle pain, joint or back pain. These are the common side effects we are undergoing from this tranexamic acid. Then dose, actually the dose here is see, for heavy bleeding, 2 tablets, that is of 650 mg 3 times in a day. And it is especially, it is directed by your physician. This is only for your knowledge purpose. Heavy bleeding, you can give 650 mg 2 tablets, that is a 1300 mg tablets. Okay, 1300 mg 3 times in a day, the doctors will prescribe you this one. But in a heavy bleeding, but in normal bleeding, 500 mg 3 times in a day, morning one, afternoon one and night one. It should not be given more than 5 days and as directed by your physician. Yes, here these we discussed here everything on the tranexamic acid. Thank you.